First, though, lots of people, including me, have noted that as the White House urges states to open, in violation of its own CDC guidelines, that there is still no plan to stop, suppress, or at the very least minimize the spread of the coronavirus. And that is mostly true, okay? There's mostly no plan, but it's not completely true. I was thinking about this today. There actually is a plan. It just doesn't involve you or me. We see the plan on full display in the president's own daily schedule, where you might notice he's been carrying out what looks like his fairly normal routine. He does his briefings in the briefing room of the Rose Garden, though he's stopped doing those as much. But he meets people in the Oval Office. He's flown across the country. He visited a mask factory in Arizona where he did not wear a mask, and they played Live and Let Die in the background. It's a rough, if adjusted version of normalcy for President Donald Trump and also Vice President Mike Pence. They both appear to be carrying on with roughly their normal lives and, crucially, duties, more or less. And the reason they can do all this is because they're being tested all the time. The New York Times reports President Trump and Vice President Mike Pence are tested frequently. Aides who come into close contact with them are tested weekly. And the list of people who need to be tested daily keeps expanding. When Mike Pence was asked why he did not wear the required mask to visit the Mayo Clinic last week, his response was that he's tested for the coronavirus on a regular basis, and everyone who's around me is tested for the coronavirus. Would you look at that? The Trump administration has figured out a way. They've solved the problem, how to bring normalcy to the daily lives of President Trump and Vice President Pence in the midst of this virus. They try to prevent them from getting sick by implementing an incredibly robust testing regime to constantly make sure that things are safe. So the Trump administration actually does have a plan. They're implementing in front of us. They're just applying it for two people. If they implemented this across the country, as other countries have, we would all feel much more comfortable about going back to work or school, movie theaters maybe, restaurants. I mean, if they were testing robustly and tracing contacts, that's also something they're doing in the White House, then everyone could have some confidence that we're safe, some rough semblance of normal. And it would not be the same as before, clearly, and you'll see it's not the same as before for the president, who can't go to his big rallies he loves. But if everyone is being tested all the time and everyone's contacts are being traced, then we would know immediately if someone contracted the virus, and then they could go into isolation. But of course, that is not the case. That's not what's happening. No, the White House is taking a kind of selfish approach. And increasingly, actually, it's not just the White House and Trump. The Republican Party or conservative line on this, the approach to all this, is increasingly becoming this. We will protect ourselves and our interests while you guys, you working folks, you get out there and you weather the virus. Here's a snapshot that kind of sums that up, pointed out to me by Matt Iglesias yesterday on Twitter, of the Wisconsin State Supreme Court. That's them hearing arguments yesterday challenging the stay-at-home orders of the Democratic governor in that state. And as you can see in that screenshot, they're all remote. They're all responsibly practicing physical distancing. They're not lined up in a meatpacking plant. But the Republican justices of that Supreme Court, who make up a majority of the court, actually question the legality of the state stay-at-home orders, as they themselves work remotely and safely. In fact, one justice referred to the state stay-at-home order as, quote, the very definition of tyranny. And the conservative chief justice even blamed an outbreak in one county on people working in a meatpacking plant.
The cases in Brown County in the span of 2 weeks surged over tenfold, from 60 to almost 800. And that's 2 weeks that would be required for emergency rulemaking. So,
these were due to the meatpacking, though. That's where the Brown County got the flare. It wasn't just the regular folks in Brown County.
Did you hear what she said? Oh, no. All the coronavirus cases, those were just the meat packers, not the regular folks. So why workers of the meatpacking plant are not regular folks to her? No, they're just the meat packers. That's what they have to go pack meat and get sick. That's not the regular folks. That's not you or me sitting here on this Zoom hearing safely. Republican officials, many of them are acting responsibly. We should be very clear here. But many of them are now approaching the virus like the screenshot in that remote hearing. And they'll tell you that instead of being locked down, you need to go back to work. But again, we know what it will look like out in the world because we've seen it in places that stay open. 2 businesses in Utah told their staffs, ignore coronavirus guidelines, and they required their workers who had tested positive to report to work. And you will never guess what happened. 68 people across those two businesses tested positive, leading one to temporarily shut down. If you just keep going about business as usual with the virus out there, and you do not come up with some really sophisticated and fairly dramatic new regimes of testing and tracing and physical distancing procedures, people are going to get sick. It's that simple. And that is the reason why Senate Republican leader Mitch McConnell said the hill he will die on in the next rescue bill is liability protection for employers, to make sure that if you get sick after you go back to work, you can't sue the boss. So when you go back to work, Mitch McConnell has a plan for your boss, but not for you. Just yesterday, the New York Times reported the task force run by the president's son-in-law prioritized tips from political allies and associates of President Trump, tracked on a spreadsheet called VIP Update. How perverse is that in the midst of a pandemic? VIP Update. The President of the United States, the White House, making sure that all the connected people got personal protective equipment for the hospitals that they were close to. Like they're running a Mar-a-Lago golf tournament. In one case, Jeanine Pirro, the Trump stalwart and Fox host, repeatedly contacted task force members and FEMA officials until 100,000 masks were sent to a hospital she favored. I should tell you we're going to have more on that later on the show. Today, the new White House press secretary was asked by NBC's Peter Alexander why everyone is not getting tested like the president.
Why shouldn't all Americans who go back to work be able to get a test before they do to feel comfortable in their own work environment to be interacting with other individuals?
Yeah, well, let's dismiss a myth about tests right now. If we tested every single American in this country at this moment, we'd have to retest them an hour later and then an hour later after that, because at any moment you could theoretically contract this virus. So the notion that everyone needs to be tested is just simply nonsensical.
Simply nonsensical. Well, apply that to the White House. The plan coming into focus from the president and his allies is that we will protect ourselves and we'll protect our interests. And you guys out there, you Americans, you are, and this is the president's words, you're warriors. You are cannon fodder that will be thrown against the onslaught of the virus. They're going out of their way to protect themselves, and they're going to send you out to make sure you cannot sue your employer when you get sick.
Trump and co. keep trying to play down testing. It is dishonest and destructive, and it is done by design. Exhibit A from new press secretary Kayleigh I Cannot Tell a Lie McEnany.
If we tested every single American in this country at this moment, we'd have to retest them an hour later and then an hour later after that, because at any moment you could theoretically contract this virus. So the notion that everyone needs to be tested is just simply nonsensical. The people who need to be tested are vulnerable populations. We have to be strategic with our testing, and we have done that so far.
She has everything there wrong, except the idea that you can't test everybody all the time. But whoever asked for that? That was never the standard. In fact, the only person who ever even implied anything like that was Trump, who falsely implied to you that there would be enough tests for anybody who wants one. That was supposed to happen weeks ago. And the reason nothing even close to it has happened is because he has done almost nothing to make it happen. Focus, though, on why they do this. Why play that game about, oh, testing? It would be silly to do what they want us to do. They want to hide the truth. Testing is truth because numbers are truth. And they want you to believe that COVID is going away faster than it actually is, because they believe the longer it is real, the worse it is for Trump in the election. The politics of forcing reopening is as obvious as it is ugly. So let's focus on the reality of what we need, and that does begin with testing and Dr. Sanjay Gupta, chief doctor. Good to see you. Now, the reason we've been hammering on testing and tracing is you don't know what to do if you don't know what you're dealing with. And hospitalizations are important, but reopening is about exposing communities, Sanjay. And unless you just want to guess, there's only one way to make smart decisions, right?
Yeah, I mean, you need to have the data. That's always been the case. Testing was the pivotal part of this, continues to be the pivotal part of this, and will be the most important thing. I mean, without the data, you really can't make these decisions. I think what's interesting, Chris, is there is these various criteria, right? Sickest people should get tested first. Healthcare workers who have symptoms, then healthcare workers without symptoms, and then basically everybody else. But the real question, I think, becomes as you start to think about opening, and I think this is what those gating criteria are sort of getting at, was how do you give people the confidence to start going back out in public? In many of these places that are reopening, one of the things you're seeing, Chris, is that people still don't want to go out because, you know, they're frightened that either they'll contract the virus or they'll, pass the virus on to somebody else. So for that reason, you got to have testing. How do you get the psychological confidence back into people? I think that's one of the reasons. And I don't know how many tests it is. I mean, if you look at that Harvard roadmap, they do say that ultimately it's, they say by July, 20 million tests a day. Okay, that's a lot, right? That would be every person in the country roughly twice a month, every 14 days. Now, that's arbitrary, but it's that level of test. Maybe it's not that number, but it's that sort of idea of testing that we need to be doing it very robustly, where people are on a regular basis, make sure it's accurate, make sure they can get the results quickly. That's going to be necessary.
Right. The paradox is his play politically, the president, is to get people back out there, but he's not giving them the thing that'll give them confidence to get back out there, which is the recognition of the risk.
Well, no president has flip-flopped more than Donald Trump. Beginning with Mexico will pay for the wall, to years of flip-flopping that has left the most self-contradictory president in history constantly trying to spin his own spin during the coronavirus pandemic. He has gone from predicting 0 deaths from coronavirus in the United States to 100,000 deaths in the United States. And after 24 hours of watching how badly his decision to end the White House coronavirus task force played on television, which is the only thing that counts for Donald Trump, today, Donald Trump said this.
I thought we could wind it down sooner, but I had no idea how popular the task force is until actually yesterday when I started talking about winding it down.
He's like the president of a failing TV network that cancels a show and then hears some protests from the audience and decides to renew the show. For Donald Trump, the coronavirus task force has always been about the TV show that he was able to produce for a couple of hours every day in the White House press briefing room. And Donald Trump canceled the TV show when the worst possible thing that could have happened on that TV show happened. And Donald Trump said the stupidest thing anyone in America has been caught saying about the coronavirus. And those are the words that will mark Donald Trump's place in history, the words that got that TV show canceled. Donald Trump's name will be forever matched with those words indelibly etched in America's memory, the way we remember Abraham Lincoln saying, "A house divided against itself cannot stand," and Franklin Delano Roosevelt saying, "The only thing we have to fear is fear itself," and John Fitzgerald Kennedy saying, "Ask not what your country can do for you, ask what you can do for your country." And I just recited all of those quotes from memory. But no one will be able to recite the famous Trump quote from memory because incoherence is too difficult for the mind to reproduce word for word. But when kids taking the SATs 100 years from now come upon this quote, they will have no trouble identifying the president who said it.
And then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning? Because you see it gets on the lungs and it does a tremendous number of the lungs. So it'd be interesting to check that. So that you're going to have to use medical doctors with. But it sounds interesting to me. So we'll see. But the whole concept of the light, the way it kills it in 1 minute, that's pretty powerful.
Yeah, that's pretty powerful. You know how it feels to be in a foreign country where you don't speak the language and no one speaks your language? That's the way Donald Trump feels every day, all the time. Donald Trump knows that whenever he's talking about anything other than golf and the leading modeling agencies in New York City in the 1980s, he has no idea what he's talking about. And since Donald Trump is firmly opposed to doing any work that could replace his ignorance with knowledge, he knows that that could happen again in the White House briefing room. That's why he canceled the show. And because we all criticized him last night for canceling the show, today he's saying something else. No one knows what's going to happen next with the coronavirus task force, least of all Donald Trump, because he is at the mercy of his moods. He does not control his moods. And so the task force might continue as a TV show. It might not continue as a TV show. It might continue as a disorganized group of people who collect information about the pandemic and share some of it with the public. We don't know. And Donald Trump doesn't know, because Donald Trump doesn't know what his mood is going to be tomorrow or the next day or the next day. That's why we will continue to bring you healthcare professionals and policy experts to share with you the latest, best information about the pandemic every night. You cannot expect the White House to do that for you. They won't. A troubling new report in the New York Times indicates that coronavirus could pose a danger to children in a way not previously recognized. Reporting on the experience in a Long Island hospital for children, the Times says in the past 2 days alone, the hospital, Cohen Children's Medical Center, has admitted 5 critically ill patients ages 4 to 12 with an unusual sickness that appears to be somehow linked to COVID-19, the disease caused by coronavirus. In total, about 25 similarly ill children have been admitted there in recent weeks with symptoms ranging from reddened tongues to enlarged coronary arteries. No solid data yet exists about how many children in the United States have fallen ill with what doctors are calling pediatric multi-system inflammatory syndrome. This is really only a disease that has been clear for 2 weeks now, so there is so much we're trying to learn about this. The chief of pediatric critical care at Cohen Children's, Dr. James Snyder, said in an interview on Tuesday. Nathaniel Lash has produced 2 important paragraphs for the New York Times that depict what the coronavirus curve looks like in America. First, there is this curve showing the coronavirus for the entire United States, which appears to be at a plateau that might be headed down, but that's mostly because the numbers are going down in the epicenter of New York. Here is what the curve looks like in the rest of the United States, with New York removed from the calculation. Just removing New York City changes that curve. The national trend is still increasing in cases of coronavirus. Michael Osterholm has joined us on this program many times. He is the director of the Center for Infectious Disease Research and Policy at the University of Minnesota. Michael Osterholm describes what those graphs mean this way. It's not a leveling off, it's a painful handoff. New York is handing off the problem to the rest of the country as New York's numbers continue to go down. The United States now has 1,234,677 reported diagnosed cases of coronavirus. And the United States now has 73,863 officially reported deaths from coronavirus.